All right then, so we need to ask ourselves this question: how does the coronary heart disease get bad or worse in terms of how terrible can it be? What's the progression, as the case may be? So let's check this out. So as the plaque builds up, it could be partially blocked. That means, okay, if the buildup is massive with time, or it's just little one, what is the effect? So for this reason, the the vessel of the coronary artery, of the artery, in this instance coronary artery, loses its elasticity, so you cannot stretch enough. Because usually when the blood contracts, when when the heart pumps the blood, the artery, if you see my video on artery, you might check that out. So it expands because the wall is elastic in nature, but because of the deposit, it prevents the wall of the artery from expanding the way it is now. So this reduces the blood flow through the artery, resulting in what? Lack of oxygen to the heart. Now, the accumulation of this fatty deposit can have two effects depending on the degree of blockage. Now, if it is partial, it means that it is partially blocked, not all the way. Like you have the lumen this way and this part is blocked. Then it's going to lead to some sort of chest pain, which is what we call angina pectoris. Please be careful at this point. Now, it doesn't mean any chest pain is coronary heart disease thing or partial blockage, because you have to be very careful right now. There are a lot of things that cause chest pain. It could be the way you're sleeping. It could be the way the things you carry, the things you lift. Probably you're lifting a weight beyond your capacity, or the kind of press ups you do, all sorts of things. Yes, push-ups. But if all of those things have been, removed, those factors have been removed, then you might think of saying, okay, somebody has angina pectoris. Because so you shouldn't just think that any pain in the chest is angina pectoris, please. You might need a physician, a professional, to affirm that to you. All right. So angina pectoris is when there's a partial blockage in the wall of the artery, coronary artery in this instance. Then if there's a complete blockage, which is not what we want, then the cells in that area of the cell will not be able to respire aerobically, so they literally die. And once the cells cannot receive enough and they are dead, that means that part of the heart that ought to contract, relax, because it can only contract and relax when it has energy and has blood supply. So once that cannot happen anymore, it leads to heart attack, which is when people just collapse, and based on the degree of how bad it is, they might actually end up dying. So this is what we're looking at here. So this is partial. This is where it starts. Then when it leads to it has built up so much. Here, the person might not even feel anything, but when it gets to this level, it's harder for blood to pass through. So the blood passes through with more of force, and that's reduce the blood that gets to those cells of that area, and that will lead to angina pectoris, which is the pain. Then if there's now total blockage, usually the total blockage happens because of thrombosis, which means blood clots. Usually the way blood is, when blood is flowing, once it's passing through a surface which isn't smooth, it stimulates the clotting factors in the body, and that's what will lead to thrombosis, or which we call blood clot commonly. So that's what happens here. So the blood literally turns back here, and all the cells ahead here couldn't get the blood supply they require, and it will lead to heart attack, which usually most times leads to death. Like most times leads to death, so to say. All right.